Hi everybody, it's Wednesday and we got a lot to cover today. First of all, before I get started, when I said last week that we were going to be talking about dentists and dentists' offices and all of that today, I said that some dentists are my best patients. And of course I meant clients. So, okay, I'll be talking about all kinds of different dental practices, oral surgeons, regular dentists. When I refer to a dentist's office or practice, I'm referring to the whole thing, not just one kind of particular one. There is so much energy in a dental practice. Think about it. You go into a waiting room to have your teeth cleaned. And you're sitting there and you hear the drill go off in the back. You grip the seats. People are scared to death of dentists. And Earthbound spirits just absolutely just suck this energy up. And you know, dentists are very nice. They're very kind people. A lot of my friends are dentists, but people just don't want to be around them. You know, it's sort of hard to describe. Your fear puts out so much energy, which is exactly what these spirits want to happen. They want you to be afraid so that you put out more energy for them. Plus, doctors or techs have to get right in your space. They wouldn't be doing that job if they didn't. And you know, there's no boundaries when you're talking about dentists. Their hands are in your mouth. What are you supposed to do? They're technicians. They're in your mouth. Not that long ago, there was a dental office that I did that actually had a ghost of a dentist that was in the office. And every time the dentist would get right in their face or start poking around with one of the tools, that ghost was standing right next to him. His face was just as close as the dentist's face to the patient. You know what? You're uncomfortable with one person getting that close to you. You can actually feel the energy from an earthbound spirit too. So a lot of times, if you have a spirit in your office that is acting like that, you may never see a patient again. They will just try to find somebody that they feel more comfortable with, or is like, you know, they're just to give them some space. But again, the whole idea of what you do, they have to be in your face. You think it's okay, I can do this, then the patient really feels uncomfortable because not only is your doctor in your mouth, but so was this ghost doctor. So again, that's not unusual. Most of the times the earthbound spirits will stand back and just watch. But sometimes they'll go over on the little tray that holds all of the dental tools and they'll move things around, knock them on the floor. Maybe the seat won't go back because they'll stop messing with electronics. Maybe the big light over your head starts blinking. X-ray machine doesn't work, or the x-rays that are taken didn't come out. They can be a little bit dangerous too, especially with computers. This happened in, for sure, 4 offices that I can think of over the past 10 years. When the staff is working on a computer, putting in information about that patient, or we got this done for today. And you know, that's the information where they have, what are you allergic to? What kind of meds are you on? I have actually had earthbound spirits that have changed that information because of, you know, being on a computer. Now, I have to admit, if it was written, they wouldn't be able to do that. But on a computer, I guess computers are great if you use them, but they can, in this instance, it could really cause some serious problems. This one office that this happened in that I'm specifically thinking about, she was allergic to an antibiotic, and it was on her chart that she was allergic to it, but she was having some kind of a procedure that she needed an antibiotic after. And it's a good thing the patient said, "What are you giving me?" And the doctor looks down and says, "This is what I'm giving you." And it was like, "I'm allergic to that. You can't give me that." It never was, they knew they had it on her chart. She'd been a patient for years, but it was gone. It disappeared. The other thing is, they cause so much trouble between staff. Now, this doesn't happen in hospitals because the nurses are on shifts. Yeah, maybe some of them work 12 hours or 14 hours, but then they go home and there's a whole other set that comes in. There's the day shift, the night shift, the in-between shift, however that hospital particularly works it. But the staff in a dentist's office, they work, 4, 5, 6 days a week, 5, 6, 7, 8 hours a day. It's the same people over and over again. And chances are, if that ghost or ghosts in an office have figured out how to push everybody's buttons, they can just make your staff absolutely miserable, including you. Because they'll start nitpicking one another. And let's face it, in an office with a big enough staff, you've usually got a whiner, or somebody that's a tattletale, or somebody that's always sick, always got a cold. You know what? If you've got an earthbound spirit in your place, it's going to be 10 times worse, because they are really going to push that so that everybody is on everybody's last nerve. Now, the other thing too is, when you are working, you're going to have headaches. You're going to have maybe unexplained stomach issues, sinus problems. When you are being drained of that much energy, that's exactly what's going to happen. And so the only thing is, you got to keep your fingers crossed, if you work in some place like this, that this ghost stays in the office for the night and you only have to see them the next day. You really hope they don't come home with you, because you need some time to be able to, regenerate yourself. Now, the worst thing is the energy drain on everybody in the place. Your patients, not so much. What are they in there? If you're lucky, you can get them in and out in 45 minutes. That's really not going to be enough time. Again, their biggest thing is being made to feel uncomfortable. This is I've answered a lot of the same questions that a lot of people have sent in the last couple of weeks, which I love. Keep it going. But this one just made it under the wire. Just got it today, as a matter of fact. It's from Fremont, California. Hi, Marianne. I've been working in a general dentist office for almost 6 years now, and I would say the worst part is always feeling quite fatigued after each workday. Sometimes it takes me 2 or 3 days of not being at work just to get my energy back to normal. And she's exactly right. That's why when you are done for the weekend, you are exhausted. Now, my question for you is about the high suicide rate of dentists. I never heard that before. And she put a little asterisk here with, there's a 1996 study cited decades of previous research on suicide rates among dentists has shown that being a dentist increased one risk of suicide by a whopping 564%. Again, I've never seen, at least in our area, in this area of Ohio, I've never seen, actually, I don't know one dentist that has committed suicide. I'm not saying they don't, but so maybe we're just in a calmer area. I don't know. I've heard it has to do with several earthbound entities jumping off a scared patient and attaching to them on a daily basis. No. the patient is not normally bringing the ghost with them. The ghosts are already in the office, and they're not going to jump on anybody. They're just going to be in the same space. And the other reason that one of the co-workers has said is she believes is due to the stress and worry they have to their high debt of student loans still paying off. Any doctor in any medical field has got tons and tons of loans. And so I don't think, again, I don't think that has anything to do with it. I think, but going like the staff, the dentist is going in every day into that same space. And if there's a lot of ghosts, and if there's more than one dentist in the practice, your increase in ghosts are even going to be higher there. So that is it for today. We've covered nursing homes and hospitals and dentists. I'm sure there will be some follow-up questions for some of these three things in the coming weeks, which we will touch on, but we'll go back to regular questions next week. And before anybody starts sending all kinds of messages, yes, I know my sweatshirt is on inside out. I slopped my lunch down the front of me, so I just flipped it around. And believe it or not, many, many, many years ago when we were teenagers, this is the way we wore sweatshirts anyway. Have a great week. Talk to you next week.